I'm truly excited to introduce our speakers, Will Nutland and Marc Thompson from PrEPster, joining us from the UK. A brief introduction of our speakers this morning. Will Nutland teaches at the London School of Hygiene and Tropical Medicine, where he's an honorary assistant professor, teaching in health promotion and in applied communicable disease control. Marc Thompson is the co-founder of Blackout UK and a director of the Love Tank. Together, they have a combined 60 years of professional experience in health promotion, and their work involves regional, national, and international work in PrEP, building across race, sexual orientation, and gender identity. Questions today will be taken after the presentation. My colleague Eric Peters, Manager of Health Promotion at GMFH, will monitor the chat for questions. And a big welcome to Will and Marc.
So thank you so much, Devon. It's such a pleasure for Marc and I to be here with you in your morning, our afternoon from rather cloudy London. I want to really thank Devon and Dane, Andrea, Eric, Derek and Antonio, who are signing for us today. It's such a great pleasure to have this invitation. And Marc and I are going to take us through in a very conversational manner some key learning from our last collaborative 60 years of working together. I know neither of us look old enough to have been working together for that block of time. But you know, the lack of London sun has been very kind on both of our skin over the years.
It's a great pleasure to be here joining you this morning and our afternoon, and as Will said, it's slightly grey. And we're hoping what we talk to you about today is inspirational and motivates you, gets you to raise and ask some questions about your practice and what the future might look like around the work that we're doing. And we hope by the end of it, there's a call to action and you take away something, even if it's just one tiny thing from this, that you can apply to your work and your practice to improve the work that we're all doing for our communities. So let's get started. So first of all, just a little bit of a background about who we are at PrEPster and the Love Tank. So I just want to take you back, because very often our story, we say that it begins in 2015 with the start of PrEPster, when actually it goes back just a little bit further. So Will and I, we worked at the Terence Higgins Trust, a large NGO in this country in health promotion for a number of years. And we both left in around 2012. And Will sent out what we now call the email. And it was sent to a number of health promoters in Toronto, in Melbourne, and in London, and was questioning what was going on around gay men's health promotion. We felt that we'd becoming a little bit sanitized, it was becoming a bit of a one-trick pony, and it wasn't dealing with the real psychosexual needs of queer men at that time, and it needed refreshing. So when Will sent that email off, it inspired a few of us, and then 4 years later, we got together around Will's kitchen table in East London here, and we did real kitchen table activism. And we set up PrEPster in 2015, and it was a direct response to what we saw was, first of all, some of the inaction from some of the larger NGOs, but also on a positive note, to support some of our clinical colleagues who are getting lots of questions and queries from men around PrEP and accessing PrEP. Since then, we have grown and we have taken on a number of different health areas which we think are really important for marginalized communities, which we have set out to serve. And in 2018, we moved from PrEPster and we set up the Love Tank. And within the Love Tank now, we have a huge breadth of work which we set up to deliver. And they range from working with queer migrant men, work directly with Black communities of all shapes and sizes. This is an example of our Black Health Matters project. We continue to be fully engaged, and we have a model which we call smart activism. We're activists at heart, we're disruptors at heart. What we really believe from our work of working inside the systems is that we need to work really closely with change makers, with funders, with commissioners, as well as our direct community. And I think today in our conversation, these are some of the things that we hope to tease out. One of the clear things we do, and I'm going to hand over to Will, is we try to learn from our history as well.
Mark's right. So as well as looking forward and trying to do work that benefits future generations of health and well-being, Mark and I are really clear that we need to be learning from all of the lives, all of the experiences, and all of the histories of what have come before us. I've got two examples here. It's actually really fortunate that we've got Mark for 90 minutes today. He's now such a media star with his documentaries and his podcast, his 8-part podcast series. We were here when Mark is charting those unheard voices of the UK HIV epidemic. That's on the left of your screen. On the right of your screen is a project that I've been involved in as part of the Love Tank called Rage On, or We Rage On, which is looking at the histories of UK HIV activists. And we're taking vintage footage from 25, 30 years ago and telling the stories of some of those activists and what we're doing now, if indeed we are still alive. And Mark and I think this is important because first of all, we have something to learn from our history in the work that we do into the future, but we're also really cognizant that there are lots of voices that never get heard. And as a project, we want to honor those voices, and we want to make sure that those voices are heard and honored into the future.
From the very beginning of setting up PrEPster and the Love Tank, we have been absolutely keen to bring in unheard and marginalized voices and marginalized communities. We have what we call an incubator model of work where we bring in new ideas and fresh talent, and we try to mentor and support those people to develop interventions, develop campaigns, to find funding, to look at how they might develop their research practice. And we're really proud that we've been able to hold a number of younger people, people who may have been in the sector for a number of years and want to try new things. So we're always kind of circling back, revisiting the work that we've done to create new, exciting interventions and initiatives. And so what we've come up with today is what we've called a kind of 10-point plan around activism, health promotion, and community building and development, and also a little bit around self-care. So should we go through those?
Let's go through those. So 10 steps towards smart activism, impactful health promotion, and community care. So step 1, we're going to talk about innovation and replication, also known as we mostly already know the answers. So the next slide isn't intended for you to be able to read. I just want to make a point from it. But if we were to set up a manifesto of what we might want to do to improve the health and well-being of Black men who have sex with men in a place like London, some of the issues on this fact sheet might help us to understand what we should do. They include having more Black and brown people working within our sexual health services, within our clinical services, making sure that the voices of Black and brown people are elevated and are brought into our community-based organisations. And there's about a 10-point plan on this sheet of paper. They're all great, amazing, inspiring things that we should be doing. And in fact, the Love Tank and other organisations are doing these things right now. But wait for a moment, this actual piece of paper that's up on the screen in front of you from the Terence Higgins Trust is from almost 25 years ago. Fast forward 25 years from when this document was put out from projects that Mark and I were involved in, we can look back and see that what we thought was innovative 25 years ago, actually lots of those actions have never been taken forward. They've never been taken forward because at the time, like we are often now, we are fueled by this idea of innovation, that innovation should be the thing that is rewarded and funded and should be at the forefront of what we do. Now, we're not saying that we shouldn't be innovative, but we're going to make an argument that we shouldn't be investing in innovation unless we can also think about how that innovation is evaluated, how it's duplicated, and how we move forward on it. I don't want to sit in another meeting when someone says something like, we don't know the needs of Black gay men and Black or brown men in the UK, when we haven't implemented those things that we learned about from our innovation 25 or 20 years ago. That's not good enough. So instead, Mark and I have been building on a slightly different model. Again, we're not dissing innovation. We're not saying that innovation is wrong, but instead we want to encourage us to think about this kind of cycle. When we innovate, we want to see evaluation that goes with that innovation. And then we want to see that innovation replicated according to what that evaluation tells us, and then adapted according to what that evaluation tells us. And then we want to collaborate to see how that innovation can be shared. So to some extent, this is a call internationally for us to collaborate. If you see something that you really love that's been done in London, don't wait to innovate to do it again in Canada. Get in touch with us. Help us to think about how this could be replicated for a Canadian audience and adapted for a Canadian audience. And then we're really happy to collaborate with you and see what we can do to make that work. But we don't need to always be reinventing the wheel. We don't need to always be saying that something that works in London won't work in Toronto. I don't buy that argument. And the Love Tank and the projects we do want to call for a collaboration, international collaborations, so we can share learning, we can share innovation, we can replicate, we can adapt, and we can collaborate. Here is one example of something that we've done recently with Tokyo AIDS Week in 2019. I said recently, it feels like yesterday, but of course it was 2 years ago. We developed a program of work called Trans People Taking PrEP, and trans people talking about taking PrEP. And instead of these folks in Japan going away and doing exactly their own project on this, they were able to take exactly the model that we had used in London, translated into Japanese, made adaptations, and went away and used that. This is what we should be doing. So our first step of our learning is, let's not spend all of our time and energy just continually reinventing the wheel and innovating. When we have great examples of things that work and work really well, right at our fingertips, if only we would be willing to move away from seeing that innovation is the things that we should always be focusing on.
Step 2, community-led. So in our work, we will often hear or use the term that the work that we do needs to be community-led, needs to be bottom-up, and needs to include the community at multiple levels. Very often this doesn't happen. But first of all, I think we can pause and we can reflect and be really proud that much of our work since the start of the epidemic has been led, driven, directed by community members. And I think we're really proud of that work that we've done here at PrEPster, and we continue to embed ourselves really deeply in our community. A lot of our staff team have lived experience. We're either people living with HIV, we are PrEP users, we come from trans communities, or we come from migrant communities. So the work that we do continues to follow that really rich history. It's not without its challenges, and we accept that, but those challenges sometimes inform our work in a really, really strong way. One example to give you before we dive into this, we have a young queer migrant man who's Brazilian who joined our team about a year ago and really quickly understood and told us that his needs were not being met in clinical services here in the UK. He spoke to us and we developed a project which we're going to talk about in a while, specifically around queer migrant men. But I think the point that we want to make today, that as our communities develop and as they evolve and they move away from traditions that we've worked with for a long time, so very often our movements have been cisgendered and male, that we know that we need to respond and make sure that we are fit for purpose to ensure that the barriers, the systemic barriers, also the barriers and organizations that may prevent some of our newer community or emerging communities from participating in our work are addressed. So that constantly means revisiting what we're doing and what we mean by community-led, and really thinking and interrogating the phrase, nothing about us without us. And we got a couple of examples of some work that we've done here. Will?
Yeah, so I couldn't do this presentation today without making a nod to the fantastic folks from the Community-Based Research Centre. I know that they're not just based in Vancouver, but this was me, I think almost 4 years to the day. I had the absolute joy and pleasure of being part of the Gay Men's Health Summit that was part organised by Jodie and the crew over in Vancouver. And I show this photograph, this slide, an awful lot because I came away from this event so frigging inspired by the work that you were doing in Canada to involve community members in your community-based research agenda setting. Although there are 5 of us sitting up on the stage in the upstairs of the gay bar in the Vancouver Gay District, look at what's behind us. Sheets and sheets of papers full of the most brilliant ideas of how community can drive our research, our HIV and our queer health research agenda. And for me, this is the pinnacle of what we should be aspiring to. This is something that I keep drawing back into the UK and saying, look what they did, look at this as an example. I'm so inspired by how community was used to drive the agenda and how community is right at the heart of your queer health work in places like Toronto, Vancouver, Montreal, and all of the provinces across Canada. So a really big salute and shout out, thank you for the inspiration that keeps driving me around this work. But what I guess we really want to get from this point too is that community-led isn't necessarily better. I'm not going to make the argument that community work is always necessarily the best work and that everything should be community-led. But it's really important that community is involved right from the start and at every stage of the work we do. If we want it to be more impactful, more effective, then community needs to be embedded within that work. So let's leave community to the side for just a second, because Andrea, if you can get ready to link up the video, we want to give us a quick break, give you the chance to see an example of something that we've done. We're about to show you what we call the PrEP Club video. And why we want to use this as an example at this point is that every single element of this video was developed by community members. You'll see in just a second what fun we had making the video. If I tell you that the only time we could film this video was after the bar had closed and in between the bar opening and the cleaners coming in. So we actually had all of us get in there at 5:30 in the morning. I don't drink anymore, but the bar manager came down at 6 with a tray of shots. And you would probably see that in the style of how the video came out. But this whole video was conceptualized, written, produced, filmed by community members coming together and saying, let's do something about PrEP. So Andrea, if you're ready to hit play, we would love to watch this with you. And so thank you. I think, Andrea, can we have the slides back on, or do I need to do that?
You'll need to share that from your side.
Lovely, thank you. Great, thank you. So kind of from the sublime to the ridiculous. So there was an example of showing something that a bunch of community members had come together, but actually this leads on really nicely to step 3, which is about leaders and heroes. So for me, the most fantastic thing about that video we've just shown you is that there's probably no recognizable figurehead person within that. There are none of the leaders that you might expect to see as the person who steps up at a conference, but actually all of those people who were involved in that piece of work were fundamental to the success of it. And whilst I'm not for 1 minute arguing that queer health shouldn't have leaders, of course we need leadership, I want us to think about the narratives that start to emerge when we talk about leadership and when we talk about heroes. Any of you who have been watching the narratives that have been happening around access to PrEP across Europe will know that there are a small handful of us who have been elevated, Mark and I included, to this hero status. You know, some of us have had documentaries and radio shows and you know, constantly asking documentary filmmakers to leave us alone. And we're doing that because actually there's another set of stories to be told that are about all of the people who have worked for decades to improve sexual health and HIV health across Europe and across the globe. And even on PrEP activism, there have been a generation of people who really set the paths before any of these leading activists came into the forefront. And so some of those stories don't get told, and some of those narratives don't get told. And what we want to, I guess, talk about as part of our step 3 is really recognizing that whilst there are hero narratives and leadership narratives, quite often those heroes tend to be cisgendered white gay men, and the voices of people of color, of trans people, of women tend to not get heard, quite often maybe because their stories aren't seen as so sellable or being so sexy. But also those, when we put some of us up onto pedestals, when we talk about heroes, this has happened to both of us, when we realize that we can no longer meet or contribute to those hero narratives, we are suddenly left with this great gaping hole, this great gaping gap in our leadership and in our movements. When one of us falls off that parapet, or when some of us have burnout or feel that we can no longer continue to do the leadership work that we do, we suddenly leave this great big vacuum. And so our step 3, we want to acknowledge the leadership roles that many of us do play and many of us have played, but also really caution about the hero narratives that are emerging and have emerged. We want to remind all of us that there are lots of silent voices that never get heard, and to ask questions about what are we going to develop new leadership, what are we going to do to create spaces for not just younger people, but other people whose voices haven't been heard. So to summarize, the dangers of us making heroes are that we quite often only hear the narratives of one voice. We miss those other narratives, and I think that's a very dangerous thing to do. But having heroes and leaders also contribute to burnout, and we're going to return to burnout at the end of this. But hero and leadership, hero narratives that put a small number of us on a pedestal absolutely contribute to burnout, and burnout in movements that are really, really unhealthy.
And that leads us neatly onto step number 4, mentoring and intergenerational. So Will's already spoken about generations of leaders and heroes. And I think that when we reflect that for gay men's sexual health, for many of us, this is the first time we have an older generation coming through. The AIDS epidemic decimated many of our communities because of homophobia, because of where we sat with sexuality. For many years, we weren't out, we weren't open, and therefore we didn't have the opportunity to have intergenerational conversations or to create intergenerational work. And we think this is absolutely key to going forward. And also, we need to have mentoring. And as Will has said, but this mentoring goes both ways. It's not just about older, seasoned people mentoring young folk that are coming in. It goes both ways. It's about making sure that cis gay men are working and mentoring others. And we're taking mentorship from a range of different places. And we've embedded this in our work. And I think that we've taken away a lot of learning from some of the different people that we've engaged with over the years, and particularly more recently. Our work at PrEPster has, and I want to kind of highlight particularly our work with young Black gay men, because I think that's really an area where there has been a huge deficit. And I think if we look at that population group, then we can expand that out across the board. So in 2018, for example, a young man approached Will and I at a Pride event, and he was just intrigued and interested in doing PrEP work with us. And with some coaching and some conversations, Phil Samba, who is pictured here on the image on the left, soon became our strategic lead for queer men of colour. We spent a lot of time coaching people like Phil, who has then reached out and has brought in other young Black queer men and has increased their awareness around PrEP, has been available to do media work, and has really put himself out there into the world. And so that mentoring work has proven to be a real bonus and benefit for us to reaching in particular audiences and groups that we never would have reached, being the age that we are, the experience that we've had, our own journeys. And so that has been really, really powerful for us. I think we both recognize, though, that there are challenges in doing that intergenerational, but also mentoring work. It can take up a lot of your time, of anybody that has done or involved in that work. But it has been incredibly rich and rewarding that we are taking on board new narratives, we are taking on board new experiences. And I think for us, it also leaves the work we're doing in a healthy place. We want to pass the baton on. We want to make sure that the experiences and the learning that we've had that can be passed down. And I think there's something also really important in this conversation is that as we age, as our communities evolve, there are lots of things that we no longer know. There are communities we're no longer plugged into. And so if we're looking about our gay men's work in particular, Will and I are no longer in the clubs. You know, we don't use the apps in a certain way, but the younger men that we're working with certainly have taught us how to do that better, but also how to reach those men. So we are hitting those communities in a much stronger way. The other thing to add into here as well is that within our work around HIV prevention, as we mentioned earlier, a lot of it has been community-led, and there is no university course. There is nowhere that is teaching you the lessons that you should learn. And so we have a responsibility to be passing on that knowledge and trying to formalize some of that knowledge as well. So we've done work over the years around trying to get men into university courses, trying to get them to do more training. So we think this is a really, really powerful tool that we have. So intergenerational work and mentoring is absolutely key to the things that we do here. Step 5, the queer diaspora. So queer communities have been connected globally since the 70s and 80s with international travel, with people flying over to New York and to London and all these sorts of things, particularly from those of us in Northern Europe and North America. In the 21st century, we're hyper-connected via social media. But what affects us queers on one continent will affect us across the globe. It's like a stone in a pond. The ripple effects go absolutely everywhere. And we've seen the rise of right-wing populist governments. And so what happens in Eastern Europe happens in the States and happens here in London. So we all need to be acutely aware of that. We have a phrase here that if one of us is unhealthy, we are all unhealthy. So we believe that we have a responsibility to connect that diaspora. Will, do you want to say something about the HIV?
Yeah, and so if you start to look around who's getting diagnosed with HIV globally at the moment, if we use the example of London, we know that at least 50% of gay and bisexual men who were diagnosed with HIV last year were not born in the UK. We see similar patterns in places like Sydney and Melbourne, in New York. So increasingly, we cannot afford to only focus on the populations that were born within our countries. we can no longer afford to only produce information, resources, campaigns in the dominant language of the place that we're operating. And I know you do this really well in Toronto, and it feels a bit like, you know, telling you a story that's obvious, but sometimes Mark and I sit in meetings in London when we are one of the only organizations that's producing information in 5 or 6 languages, that has a diverse team that can speak, you know, a dozen languages between us. And we should no longer be in a place, particularly in a place like London, where there are services that are offering HIV prevention care and support to queer people when English is the only language that is being spoken. It's totally, totally unacceptable. And it's one of the things that we have really been rallying around over the last 3 or 4 years.
I think, and just as we move on, what we've also learned as well, and I think many of you on the call recognize, when we think about communities within communities, those communities are incredibly diverse. So when working with Black men, we are thinking about Black men from across the African diaspora. When we're speaking about Latino men, we're thinking about all of the differences that those various regions will bring along. So again, thinking about the queer diaspora also gives an opportunity to think a little bit more deeply and interrogate what we mean by when men come from those various groups. So step 6, is about how we collect globally. We truly believe that we need to connect globally. There is strength in numbers, in sharing our resources and sharing our ideas. And we've done a lot of work at PrEPster and Love Tank. Just being here today is a real example of how we can connect globally. So whilst it's a great joy to talk and present to you, we hope from some of your questions and your comments, we're also learning and we're building connections. Over the past few years, we've worked with the Global Black Gay Men's Connect organization based out of New York, which pulls together Black gay male organizations from across the globe. And I'm on the board there, which has been a fantastic way to share ideas and programs of work across the African continent, North America, the Caribbean, and Latin America and Europe to connect those dots for Black queer men. We've developed recently a fantastic project called InnoPup, which is the international network of people using PrEP, where Will and I felt really, really strongly that PrEP users around the globe are working at multiple levels, from lone wolves in a single country to bigger organizations or networks. And we've created InnoPup to bring those people together so they can share learning, share advocacy, share resources. And we think, again, this is the future of how we can connect globally as a queer movement. And
yeah, so similarly to what we just talked about queer diasporas, we've been unapologetic in the work we do to really forefront people who are coming into the UK or who've lived in the UK for a period of time, who have insecure immigration status or who don't have UK addresses. Again, we know some of our sibling projects, some of the sibling organisations have not wanted to go near this as an issue, particularly in the light of the really nasty right-wing discourses that have come around with Brexit. But we have actually been incredibly proud to be able to come out and talk about how we intend to work with and support queer men from around the world who are seeking refuge, who are coming into the UK, however they come in. And again, with Mark and I feel that it is an important and essential aspect of queer health work, wherever we're doing it in the work, to be unapologetic that we are standing shoulder to shoulder with our queer siblings, particularly our queer trans siblings, given what's going on for trans people around the world, and being absolutely clear that we will provide a welcoming, a supportive, and unambiguously loving spaces for those people. And it's a really important part of our queer health politics and our queer connectivity to do that.
So step number 7, connecting siloed social movements. So very often when we're looking at our work within this particular field, we tend to look at HIV prevention and we tend to look at sexual health and they're standalone. And we believe that it's really is time to connect our movement with other social justice movements. As I said in our previous step and tip, is that there is power in numbers, in resources. And so we've been working really hard to make sure that we are connecting with the Black Lives Matter movement, with the women's movement, and with the environment movement here in the UK. We believe that there are benefits for us because we've often spoken, or we all talk about that word, intersectionality, and intersections which impact on our health and our well-being. And we really believe that by connecting those movements, we can start to address some of the real issues which are impacting on all of our communities. We think it's a two-way street, though. We think it's a two-way street. It's not just about us getting in there and making sure that sexual health is understood, or HIV prevention, but it's also about increasing the visibility and the involvement of, say, queer people and people of colour in the environmental movement.
And so I'm not going to let Marc get away without, I'm going to take you back 2 slides, because Marc, tell us what this is, because it was a pretty spectacular piece of work and a really great illustration of how you did exactly what you just talked about, not working in a silo.
So basically, in London, we have the London Transport for London, which is our underground system here, and they invited 5 queer activists to develop the tube signs, which you will see on London Underground stations. So myself and our creative director, Richard Kawaji, and the photographer, the Black queer photographer, Ajamu X, created around, that's the official name for it. And what we wanted to do was disrupt and challenge the system around representation of Black queer men. So we took Joseph Beam's statement, "Black men loving Black men is a revolutionary act." We placed Ajamu's quite provocative image, which you will see in a moment with another one of our videos. And Richie did this beautiful design around breaking the chains of toxic masculinity. And we placed this in Brixton Tube Station, which is where I live, which has a long history of African Caribbean people living there, but also a long history of Black queer activism. And this was placed front and center in the station. And it was about kickstarting a conversation about visibility, representation, Black queer lives, Black queer health, toxic masculinity. And so we were really proud of it. Within a week, it was taken down. We're not sure by who, but again, that started another conversation around visibility. It was the most provocative of the 5 that were placed. The rest were pretty much lots of rainbow flags, which was cool. But we wanted to do something which was kind of challenging and disruptive, and I think that we achieved that here.
So thank you. I couldn't let Marc get away without explaining that, but we're gonna move in a very different direction now, and we're going to talk about step 8, which is about how we can't talk about sex with no sex. And so for the last, I don't know, 15 years or so, Marc and I have been really cognizant that in the conversations that we have around sexual health, we have seen what we describe as a sanitization of talking about sex, and gay sex in particular. Just before I left Terence Higgins Trust, Marc and I were both involved in a piece of work that included photographs of flaccid penises, no erections, but flaccid penises, that 2 of the leading gay magazines or newspapers refused to take, because they wanted to start making their publications more acceptable. One of them wanted to start having their magazine available from supermarket shelves, didn't want to have any images of penises in there, because if they did, they would have to shrink wrap them and they would have to go up on to the top shelf. Some of the advertisers in those magazines had kind of nodded and said, well, we'd love to have adverts for the latest album from a girl band, but actually if there's any cock shots in your magazine, then the managers of those girl bands would pull the advertising. And I think what we started to see was the kind of the drip feed of the sanitization of sexual health, particularly around narratives of what it was to be an acceptable homosexual. So all of the push for gay marriage, and this kind of acceptable faces of what queers look like and what queer health looked like. I was really struck about 3 years ago. I was talking at a World Health Organization event in Switzerland, and I suddenly looked back at lots of the work that PrEPster had done and realized that we had fallen almost into that same trap, that we were trying to talk about something that was primarily prevented through sex. HIV primarily in the UK is sexually acquired, and yet we were kind of almost hiding. We were almost not talking about sex. And this really shook Mark and I when we realized that we were falling into some of those same narratives. And so as part of the work that we've done over the last 2 or 3 years, is that we've started to celebrate the perviness of some of the work we do. We're not saying that this is right for everyone, but as a self-identifying pervy slut, I'm quite happy to have led the march on this one within the team. And so here's a fairly new piece of work that we've done, which is on our website, prepster.info/prepverts. And this leads with, how can we talk about preventing something that's sexually transmitted when we don't talk about sex? And it led us to do a couple of things. One of them was that we did a photo shoot. You'll see a little bit more about the photo shoot in just a moment, when we actually became unclothed, had photographs of me spanking a beautiful young man, people in states of undress, when we actually started to talk and use language that many of us had been used to in HIV prevention a decade or two ago, but which most of us had really felt like HIV prevention and sexual health work had become sanitized. And we from that same photo shoot, we plastered this image all across UK Black Pride 2 years ago. And another conference presentation will talk about the impact this had on a massive increase in the numbers of Black queer men ordering sexual health testing. That's probably something we don't have time to talk about today. But we would love another video shot, Andrea. We would just love to show you some concepts of how this project came together, and invite you in your practice to really start asking the question, how can we talk about something that's sexually transmitted if we don't talk about sex? So Andrea, we're ready for you to hit them.
You ready? I'm not.
We're here to put on some kinky clothes and take some pictures. We're trying to promote PrEP.
PrEP is it's a drug that you take in order for you to not contract HIV.
The government's doing nothing to advertise it in different spaces, so PrEPster have taken it upon themselves to, advertise in different spaces that can reach people that are disproportionately affected by HIV.
Traditionally, we've focused very much on white men, white gay men, so I think today we're looking at men across the spectrum really.
Lots of the work around sexual health, the images are just not that sexy, and we need to have more images that are sexual, that reaches people who are part of the SM kink scene. We need to see images of Black and brown bodies who are part of the SM kink scene. The missing image from sexual health is Black men on Black men being intimate, kissing. My work is always about creating the images that I can see, and then also to create images that I think conveys how I feel about sex and pleasure and the body as well. We need to always have a counter narrative that says, well, actually, our stories, our narrative, our kinks are just as important.
Andrea, let us know when you can. Oh, great, thank you. Lovely, thank you. So I hope you enjoyed that little sideways path into a bit of kinkiness. And that takes us on. We have the penultimate step that we want to talk about this morning, this afternoon for us, and that is that activism is health promotion. And I want to share, go back 30 or more years when I used to volunteer in my local Oxfam shop. I know when most teenage youngsters went out and were doing sports and all those kind of things, I spent my weekends rummaging through piles of dirty clothes with old ladies. I did that because I was perplexed by the world that I saw around me, and I felt like it was a very small contribution that I could make. But also, I was inspired by the gender activism that was happening within Oxfam at the time, led by some real kick-ass feminists. And they produced a set of posters that really caused some conflict and upset, because most of the other volunteers in the shops were of a particular generation of retired people, and suddenly there were these feminists who were coming into Oxfam and were saying that we should be political, we should be asking questions. And this poster, again, most probably 14 or 15-year-olds at the time had pictures of semi-naked pop stars on their bedroom walls. I had this poster on my bedroom wall. Mark, I know you through your head, this explains a lot, but the hand that rocks the cradle should also rock the boat was a mantra that inspired me. And for the last 30 years, I've been trying to think of a health promotion analogy. I don't know, the hand that gives out the condom should also, I don't know, there's something there. But it inspires me, and I want it to inspire all of us collectively, because a lot of what we think about and we talk about as health promoters is when we ask the question, what do you think a health promoter is? Quite often we think, oh, it's someone who does outreach work, or it's giving out a booklet, or it's having a stall where we stand behind a table and people come and ask us questions. But actually, health promotion is way more than this. Health promotion is going and fly posting provocative and sexy and hot images about PrEP on roundabouts in Berlin. This is where this is from. And here's another great example around innovation and collaboration. We did this poster for a club night called NYC Download that's held at Glastonbury Festival, and some folks from an organization in Zurich saw it there, called us and said, can we take it and use it here? And so these folks have just kind of taken all of our artwork and our imagery, stuck their own logo on it, run it through a photocopier, and then just pasted it all over Berlin and Zurich. This is the kind of stuff that Mark and I absolutely love seeing. So health promotion isn't just about behaving and being nice. It's about misbehaving. Health promotion is also about testing generic formulations of online PrEP and seeing that it's the right thing, and helping individuals who want to buy PrEP online to do so safely and legally, or even not legally. This is actually my blood taken a month after I've been using this generic formulation of Mylan's Ricovir, Ricovir EM, and I was part of a scheme of underground clinicians in London who work with those of us who were already buying that PrEP online, and they would kind of take us into a side door of their clinic, test our bloods, and worked with us and the folks at I Want PrEP Now to see if the PrEP really contained the pharmaceutical products that it should. And I know that there's been some great examples in Canada of activists who are helping people facilitate generic formulations of PrEP and bring it over the border. I had the honor to meet some of those people 4 years ago. So all of these things are health promotion. Activism is health promotion, and as well as taking government institutions to court when they won't provide medical products that stop us from getting potentially a killer virus, or we don't have access to medication, or people are being homophobically abused or trans abused in the countries that are trying to escape for. Health promotion is taking our institutions to court. It is making a noise. It is fly posting. It is helping people to get access to abortions if they can't get them, and helping people to get over borders. And I'm unapologetic, Mark and I are unapologetic when we say that all of these things are health promotion. The Ottawa Charter, that is something I absolutely love and adore. Thank you, folks in Ottawa, for helping to create the Ottawa Charter. The Ottawa Charter supports us in doing all of these things under the name of health promotion, and don't let anyone ever tell you that any of these things are not valid health promotion. All of them are.
And just before we move on to step 10, we need activists now more than ever. We mentioned the pressures and the things that are happening globally for all of us and the various communities that we occupy. And activism has in some ways becoming a dirty word for some of our politicians. So please remind yourselves that we need to be activists and to be active more than ever. And health promotion and professionalism in our work can sit side by side. And I think we do that unapologetically and proudly in what we do. So step 10.
So step 10, yeah, care and burnout. And we've already talked about this in the context of leadership and heroes, but linked into everything that we've talked about is the need for care and avoiding burnout. We need deeper conversations about self-care, about our work care, and about our community care. This work that we all do is tough. It's really tough. And we can't be on the front line every single day. And the questions for us are, what should our organizations and what do our organizations do to provide care and nurturing? Burnout isn't inevitable. Burnout isn't a rite of passage. I'm not proud that I burnt out. I know the times when I've burnt out, and I know the things that I wish I had done differently. And part of the mentoring work that Mark and I do with some of our younger team members is help to navigate them through paths and offer them care and support, both personally and within our organizational structures, to hopefully mitigate against them burning out. But care and the care that we offer within our organizations needs to be more thought through. It needs to be more radical. And as a colleague of ours, Shona Fay, in her recent conversations with Mark, she got a great new book out, when she was talking about self-care, she said self-care shouldn't be about just lighting a candle and having a wank. Self-care needs to be about thinking about our work patterns, challenging our infrastructures, being much clearer about drawing boundaries about what we will do and won't do. For example, as managers, understanding the impact of social media abuse on our staff members, our volunteers, and our colleagues. And our question for all of us to consider and to think about is, how are we going to do self-care better? What are we going to do differently into the future?
So we move on to what next. And so we started off this conversation with giving you some ideas. We hope that it has been something which has inspired and motivated you, and you can take one or more, hopefully, of those 10 points that we've got. And we think that what we really want to do is to continue to connect and ask you to continue to connect and to consider the things that we said, to reinterrogate your practice, to try new things, to innovate, but also to evaluate and replicate the work, as Will has said, to make sure that you are practicing self-care for your staff, that you're connecting the queer diaspora, all of the things that we've done there. We know these aren't easy times for all of us. We know that there are threats from all over the place. We're coming out and going back into the COVID pandemic, as well as everything else, as well as cuts to our funding globally and locally. But we want you to remember that they don't want you to remember that anything is possible. And we really, really believe it is. We believed in the power of imagination and taking risks and taking chances and doing new things. This is what our forebearers did back in the early 80s and the 1970s with the gay liberation movement and response to the AIDS epidemic. And we could continue to do that. So we just want to say thank you so much for taking your time to listen to us today, rattling through those slides. We hope you found them useful. We hope there's something that you can take away and put back into your work and also back into your lives. So thank you very much for your time this afternoon and this morning.
So anything is possible, folks, and here's how you can track us down if you want to. thelovetank.info is our overarching website. It's about to go through an overhaul. PrEPster.info, you can find out everything about PrEPster, or hello@prepster.info if you want to email us. And there's both mine and Mark's Twitter and Instagram. We would love to hear from you if you'd like to connect with us. We're going to take that slide down, and if you haven't written those things down fast enough, then I'm sure Devon or Dane or Eric or one of the colleagues there will be really happy to connect you into us. We'd love to chat with you more. I think we've got about half an hour. So I'm going to take these slides down and let's talk.
Thank you so much, Will and Mark. That was most innovative, tantalizing, provocative, and explanatory in terms of the things we do. I love the line of activism is health promotion, which I think we need more of that. And in my experience of doing work in HIV over 25 years, I have seen a slightly more of sanitization of how we do the work. It's as if we need to do health promotion, but no one is having sex. So we don't really talk about it. And one of the questions we have for you is that, and you did talk about this in terms of advertisers pulling back when they saw a penis, because you can't talk about that if you don't talk about penises and vaginas and genitals. Right, in PrEP, which is one of your projects, for this project, we focuses on PrEP and hot, kinky, sweaty passion, and you showed us the video. And to quote the videographer, a lot of the work around sexual health images are not just that sexy. So PrEPster videos are, in my opinion, and being old and seeing a range of stuff over the years, it's very refreshing, stimulating, and relatable to the viewers of many of us queer men, cis and trans, right? To generate sexual health in a Canadian context, we're still very conservative. If we look at what different organizations are doing, from not even working just in generally sexual health context, and slightly Victorian, I have to say, in my work across Canada, and many of my colleagues too. So how does sexual health and sexual practices and sexual behaviors are portrayed rather sanitized? And much of these are guided and basically by default by morality, funding guidelines, and discomfort of overt same-sex sexual imagery and practices. So can you give the audience some other tips in terms of how you deal with pushback from the public, social media, bureaucrats, and funding sources? Because we want to do the work, we know what the community needs, but we are kind of tied with what we're allowed to do.
Devon, before I answer that, can I just say a shout out to Michael Quagg? Hello Michael, I've just seen your face appear. It's so lovely to see you. I hope, yeah, there you are. Hello, sweetheart. Devon, can I, my first starting point, I think, just to be clear, that I think Mark and I are in an extraordinary privileged position, and that is that we are choosy about who we take funding from. And when we set up PrEPster, I mean, we do talk about, kitchen table activism. It started from my kitchen table. It started with us selling PrEPster t-shirts, which is how we funded the first iteration of our work. And we were able to do things that other organizations could not. So other organizations that were funded through either central government or through local authorities or through pharma. And so right from the start, we were able to kind of stick up a middle finger and say, we're going to do it in our way. How that's developed over time is that some funders have come to us and said, it's so refreshing to see you do things when we think some of the other organizations have become stale. How can we help you? How can we support you? However, we've had to grow up as well. We now have a team of 8 of us, and we don't want to become another bureaucratic organization. But I also have to work out how we're going to pay the salaries of, you know, those young queer people that Mark and I are mentoring. And so we have a sense of realism as well. So that's meant that for some of our work, we've made compromises. But that hasn't stopped us from doing the things like PrEPverts. We just don't fund them through funding streams that wouldn't allow us to do some of that work. We've also had to navigate some really challenging issues with people like Facebook and Instagram and Twitter. So there's the syphilis, long time no syphilis work we've done, which was the second slide that I showed. None of those platforms will take advertising for our syphilis work. They've basically banned all of our syphilis work. And to be honest, you know what? We get way more engagement organically on all of those platforms. So we've built up really nice followings, particularly on Twitter and Instagram for that work. And we actually get more engagement through organic posts than we would have done through promoted posts anyway. So we didn't want to give them our money. So, you know, we've saved money. We've also, Devon, thought of other ways of trying to reach people if we think a funder or a particular place won't allow us to take some of our stuff. A really great example, some of you might have seen across the summer, is that we've been lucky for the last couple of years to get some core funding from the Elton John AIDS Foundation, and I have to say they've pretty much let us get on with it. They've been brilliant. There are no restrictions on whether we can show, you know, pervy stuff or not, but we hit up against an issue that we were not allowed to do promoted posts on Facebook. And so we transferred the funding that we were going to give to Facebook. Instead, we printed 350 PrEPster vests. And we offered those PrEPster vests to anyone who lived in the UK who wanted one for free across the summer, on condition that they would wear it somewhere and that they would talk to people about PrEP. And we could not give those t-shirts away fast enough. And everybody who got a t-shirt got an information pack that asked them if they felt comfortable to take a photograph of them out somewhere with the vest on. So it could be at the gym or at their local walking club or their mum's group or wherever. And then 5 information cards with a QR code on them that someone could scan onto their phone and go straight through to our page that told them how to get hold of PrEP. That did 2 things. Our web traffic increased by 1/3 across the summer, and our inquiries, our individual one-to-one inquiries through email and all of our platforms trebled across the summer. We would never get that by spending $2,000 on a Facebook advert, and we were completely unrestricted in what it was we could do. So that's kind of a long way of saying we don't feel restricted, we can be brave, we can find other ways of doing something. And to be honest, if someone is so restrictive in their funding that we can't say fuck or bugger and show a penis, then we're probably not the right people for them to be funding.
And if I just add to that as well, Devon, is that what we're also doing, we're not dissing other work. What we're trying to do is to fill a gap, but also to restart a conversation. And our PrEPverts work is one example of the stuff that we've done. We've tried to make all of our work sexier, but we recognize that some of that work may stop some men from engaging. So it sits within a suite of other work that we do. So some of our work for queer migrant men isn't as sexualized. It is a little bit more, shall we say, vanilla, but then men can lead into that. So I think what we're doing is throwing down a question to our colleagues who work within the HIV prevention sector, particularly doing gay men's work, to rethink about the sex. We don't want to see another condom on a banana, but we recognize that for some audiences that will continue to work. So we just have to make sure that our work sits alongside that work.
I have a question from the chat. Where can someone buy one of your t-shirts with it? Will, the t-shirt you're wearing?
This one. So we actually don't have a merch shop online at the moment, in part because I don't want to spend all of my time running backwards and forwards to the post office. But if anyone would like one, then fire an email and we'll work out a way of arranging that. So hello at PrEPster.info, and I will work out how we can do it.
On the PrEPster side, there are amazing images of, as a man of color myself, and I've seen the history of how things have evolved over time from a Canadian concept. On your website, there are amazing representation of diverse queer men of color. While in a Canadian context and across HIV and gay bi MSM sites and posters, we often see a bit of tokenistic imaging. And although we talk about it as being tokenistic, it is still sort of done. And right now, what many organizations have done, different ethno-racial groups have taken on themselves. So it's a bit of a splitting of how each group does the work. But there's no one collective organization that brings all of it together that is really open and visible. So can you mention any specific ideas, conscious raising for the Canadian HIV, gay bi MSM communities, like how to do this work in a collective way, so we're not all working in separate sections?
I mean, I think one of the ways that we started with our work, if I'm understanding your question correctly, was to work directly with men from those communities to try to ensure, because historically, if we're thinking about men of color, traditionally they haven't engaged in the work, or they, many years ago. So there's been a tip off from that, a drop off from that. And I think by recruiting and working with young queer men of color directly from those communities themselves, incentivizing them, giving them the training, giving them the opportunities to ask what they want to do, and to put them in the driving seat, to give them the tools to design and develop the campaigns and interventions, has really helped us around inclusion, wouldn't you say? Mm-hmm. Yeah.
Great, thank you. I think Michael Quack wants to ask a question to you. Michael, you want to go ahead?
Oh, sure, thanks. I just really wanted to say thanks to you, Mark and Will. What a wonderful presentation, and really appreciated the shout out to the CBRC Summit from, gosh, I think that was about 3 years ago. So thanks for bringing me back at least to that really great day. And I just really want to say so much of what you presented about spoke to me personally, and I think resonates with a lot of folks, just in terms of this sort of tension of needing to obtain funding and support, the next generation of leaders, and building more and more opportunities for those that are sort of slowly getting involved in this work to have more meaningful roles. And I think, but at the same time, not getting too complicit, in being sort of institutionalized, being part of the system, and not having the same sort of engagements with our communities. Thinking what you said about disrupting and being transgressive, and how it's still so essential for us to maintain that. And thank you for sharing all of the different sort of examples of campaigns where that, you really brought that sort of spirit and principle. I'm wondering sort of where you think the next sort of frontier of, disruption in queer men's health, might be. Is that around trying to extend what we're doing with HIV PrEP to STIs, and sort of thinking about like how we sort of support those in our communities that are really taking matters into their own hands to sort of experiment. And, given that governments and public health aren't always looking for our own best interests, what are your thoughts in terms of like, next steps or next frontiers in terms of community-led activism?
Michael, again, it's so lovely to see you. And, I think the journey that I've been on, and Mark has been on, since we both left Terence Higgins Trust, and again, I'm not disparaging THT. They have some really brilliant, unique selling points. But I can remember in the last few years I was at THT being really despairing that I felt we couldn't engage with some of a new generation of people to get involved in this work. And now I'm absolutely gobsmacked, because there's 8 of us in the team. I'm the only white British person in the team, and you know, I've never been in that situation before. It's a brilliant situation to be in. We have the most brilliant, diverse, engaged group of people. Under half of our, more than half of our team are under 28. And you know, when I was at THG, this was unheard of. And I think the thing that's been exciting is that the work we do at the Love Tank has been relevant to those guys. Yeah. And in part, I think that's to answer the question about, you know, what's new, what's the next thing we should be disrupting. We should be making our work relevant to the lives of the people we are working alongside. I think also we've had a real privilege for the last 5 or 10 years that PrEP has been this new bright shiny thing that has enabled us to really re-engage with people around sexual health. And I think that light will burn out very quickly. I think, you know, PrEP being the bright shiny thing it will not be for much longer. And I kind of think that engaging around sexual health more broadly might be that next thing, although the work that we've done around syphilis and gonorrhea in the last couple of years illustrates the huge number of challenges that we have. But Michael, I think that from the younger guys that we work with and we engage with, it's around community and it's around mental health. And you know, all of the guys we work with, it's again such an honor to be working in a team, a direct the people who volunteer and interact with us, when they are so upfront about talking about how they're feeling, why they don't feel like today's a good day to be doing something, the support that they need, the support that they're offering each other. And Michael, this really takes me back to some of the early conversations that you and I had with Rick and Terry. Heads up, Rick and Terry have been 2 enormous mentors to me for the last 25 years. I owe them a lot. But Rick and Terry talking about, you know, what makes community, what makes us think about queer health and our needs. So for me, I think it's about mental health and creativity is the next disruptive thing.
And to add on to that, while we're disrupting, going back to one of our steps, which is around connecting siloed movements, is that our movement as queer men needs to be broadening the lens and needs to be looking at how we are working alongside our trans siblings, how we are looking at anti-racism and our misogyny, and how we connect those things. Because as Will said, the shiny things that we've got and we've done and we've achieved over the years are great, but we should be sharing that learning. But also, if we want to bring new people in, if we want to work with these younger communities, they are certainly on the page of going, if your work's not intersectional, I'm not interested, I can take this over there. And so that is going to be another real challenge for us of giving up some of that power, giving up some of that space to new folk and having a truly intersectional, diverse approach to the work that we do.
I mean, if I could just respond quickly and just say, I think both of what you're saying is resonating so strongly with me. I mean, I think these are the kinds of things that we hear, you know, in terms of unmet need, you know, like, and it's not like folks in our communities are siloed and thinking about, you know, is it a sexual health issue? Is it a mental health issue? Is it, you know, like, I think sort of thinking much more holistically and intersectionally. And, you know, I think it's about, when we talk about rewriting routines of care, it's not just about within the health system, it's also, you know, within our own communities and in the way that we organize. So thank you. I just wanted to, I really appreciate the opportunity to ask this question and hear from you guys. Thanks.
Thanks, Michael.
Thanks, guys. Thanks, Michael. Jordan, Dane, you have a question?
I do, yeah, thanks. Also, just like, thank you both. This was really thought-provoking and also a relief in a way, because I feel like a lot of the work at GMSH, particularly around our communications work, campaigns, and our digital content is moving, I would say, really nicely in the directions that you spoke to, in ways that are less sanitizing and putting sex back on the agenda in a really intentional way. I had a question come through on the chat to me. How do you reach, you folks are based in London, global city, huge gay population, much like Toronto. How do you reach communities, and what's PrEP uptake looking like beyond London's borders?
It's not as good outside of London. It's not as good outside other major cities. And that's a real challenge. I mean, you'll probably have heard of Dean Street, which is a 56 Dean Street, which is a clinic based in Soho, kind of world renowned. And Dean Street is providing an awful lot of, I mean, the last count I did, there's something like 12 to 15,000 people are getting their PrEP through Dean Street, which is absolutely extraordinary. But it is an extraordinary service that is not replicated in other parts of the UK. And we are certainly challenged by PrEP provision in some parts of the UK, not just in places that aren't part of big cities, but even some of the big cities, we are hearing reports of PrEP being really hard to access, or it's hard to make an appointment. And Dane, I think it is likely that we will see some people revert back to buying their PrEP online because they feel that the services that should be providing PrEP for them are not able to provide a PrEP service for one reason or another. And one of them being lots of services are really still suffering from staffing issues because of COVID, or just because of lab issues due to COVID. So I think we still have long ways to go. This is why we have had conversations with some of our funders who said, great, we don't need to fund you anymore. We've got PrEP in the UK, we're all sorted, off we go. And it's brilliant. Well, we're saying it's not sorted. Plus, we know who's getting PrEP, who's first in line for PrEP. Well, it's men like me. It's white cis men of a certain age who live in places like London. We know and we hear stories every day, which is why we have our Queer Migrant Men project, that if you don't have English as a first language and you don't know how to navigate the free health system, then you are less likely to access PrEP. We hear of guys who arrive in London and they don't understand that sexual health services are free for everybody, regardless of your immigration status or your residency status. Or they're scared that if they don't have secure immigration status, that the sexual health service will report them to the Home Office. So lots of work that we're now doing to try and help people navigate that system. But we also know last year in the UK, a third of new HIV diagnoses were amongst women, and the numbers of women who are accessing PrEP compared to gay and bisexual men is absolutely minute. So, excuse me, there's also as well as a geographical issue for us to address, there's also a really massive gender imbalance that we need to be doing a lot more work on.
Thank you. Yeah, and if I can just take a moment to plug our next session, we're going to hear more about that actually in terms of who are we reaching with PrEP in the province, what their profile is. And I think we'll hear, you're speaking of barriers in the UK where the policy environment in terms of access to medication and PrEP in particular is much better than it is in Ontario, where cost still remains the biggest barrier to access here in the province. And so we're going to hear more about that on some sessions this afternoon. And so we hope folks will be able to join.
We have a couple more questions. I've got one, and Eric, I think, has got one. In your project, GoodiePup, it's a very innovative approach to using GPAP principles to advocate for PrEP. So could you share with us some of the most impactful messages, and were there challenges, and if so, how were they addressed?
GoodiePup, did you say?
Yeah, GoodiePup.
Yes.
Okay, I think one of the challenges around the work we've done or are attempting to do around GoodiePup is because it's an international collaboration, is trying to bring people from so many different parts of the world together to reach consensus. And that means reaching consensus around what the priorities should be, people working in different practice fields with different policy agendas and with different political systems. So certainly one of the most recent challenges with Goody Pup, which is the project we're doing with AVAC to devise good involvement of people using PrEP, has been trying to devise case studies that can be relevant for as many different parts of the world as possible. We're actually finding that for every case study we write, we're finding that about half of the people we're talking to about it just say, this doesn't fit our current policy agenda. So again, as a way of plugging InnoPup, which is separate from Goody Pup, sorry for the confusion there, Goody Pup is the guideline, creating the guidelines, good involvement. InnoPup is the international network of people using PrEP, is that InnoPup is really giving us a sounding board to better understand how we can implement that Goody Pup work.
Excellent. Eric, you had a question?
Yeah, thanks, thanks, Devin. And thanks, Mark and Will. This was beyond, anyhow, Will, last year, talking about the sanitization of sex and bringing sex back into the work. Last year, I attended your online webinar around kink and fetish in the context of HIV prevention, right? Now, I attended because I just wanted to be in a room with other Black women talking about kink and stuff. But when I got into this space, I stopped concentrating on the fabric and started to look at the garment because the content was so different. I shifted in the way that I was receiving the information because I had not been in a room before with Black women talking around kink and fetish. And hearing it in the context of HIV prevention was not only novel for me. I found that all the titillating aspects of it left, and I was there on how Black men were getting engaged. What were some of the things that they were saying that it became so normalized and destigmatized, and I felt really good being in that space. Now, for me, I had lots of takeaways, and I wanted to go out and just started to do stuff like this, but these things just don't happen just like that because the space was made welcoming and comfortable, and with those type of didactics, the magic happens. Yeah, and I was so taken away by to be absorbed in that magic. So for you, what were some of the takeaways that came out of that webinar, and how did you implement that in your HIV prevention efforts?
Well, I think the takeaways. I mean, I think first of all, I mean, that was driven by Phil Samba, our strategic lead for queer men of colour, and also Ajamu X, who shot the PrEPvert's video. And as Ajamu said in the video there, that he's very keen that when he looks at sexual health work, it's not very sexy, and it doesn't include Black men, it doesn't include Black men being intimate or talking about kink. And so we've always been committed to ensuring that the fullness of our sex lives is represented. And so this is why we wanted to do the webinar, because it was, for us, it was a bit of a no-brainer that this is a conversation that isn't happening. And going back to the freedom that we have as an organization, we're able to put on events like that and start conversations. And Eric, I'm just so pleased that you came away from that going in with one idea and coming out with it with something really different, and feeling affirmed and feeling seen and feeling welcomed in there. And what that does for our work is it goes on and it informs the whole range of stuff that we do. So we've just recently started on work on a new video, working with young queer men of colour around their PrEP use. And we've made that really sexy and really informative because we understand that Black men do want to have those conversations. It was, I think, one of the lessons certainly for me was about giving people permission and the space to do that, because for too often and too long, that isn't there at all.
And Eric, you said something just then that really resonated for me, and this was about being around people when you found magic, and why this really resonates for me in the context of this conversation is I found that magic in some of the forums I've been involved in, particularly in Canada, because I feel like the way health promotion is conceptualized within the Canadian political, cultural, social, political system feels I have a resonance with it. And I know I've come away from some of these summits and conferences and meetings with a sense of magic. And then when I go back into my own workspace, that magic dissipates because I don't feel necessary that I have my peers around me to enable that magic to happen. And so my invitation and my wish is that when we feel that magic, we say it and we identify it with the people we feel it, and we invite them to return back together to help us remember the work we're doing and the work that we can do when we are empowered and supported and feel that magic. So Eric, please an invitation to come back together with those crew. I know I wasn't in that meeting, it wasn't for people like me, but we would, the Love Tank would love to facilitate a revisit and see if we can create some of that magic. And actually I know some of the magic that did come out of it was that Ajamu and some of my other colleagues at East London Fringe Film Festival that will be happening in a couple of weeks' time. We run a weekend of workshops called the Love Hub. And Ajamu is actually going to be running a workshop called Wet Play, which will take some of that learning from the Kink workshop forward. So, that's an open access to anyone around the world to join that workshop. That won't just be for queer men of colour, but there will be queer men of colour leading that workshop. Eric, maybe you can help reinvigorate some of that magic at that workshop if you'd an invitation to you all to join any of those events if you'd like to.
I'm just
Absolutely.
Summarize the last question. It's not to tire both of you out. So in public spaces, transphobia can be particularly high. What sort of strategies have you found success with combating transphobic sentiments and increased safety with regard to sexual health?
So the first thing that we have done, and actually we did this about 4 years ago, was we made a really, really clear statement about our organizational position on transphobia and saying what we would do, what our intentions are, and the growth that we needed to make as an organization. But we also made it really clear that as an organization, we will not stand for transphobia. That means in some of our meetings, in some of our forums, including at Fringe Film Festival, we will vocally ask people to leave if they express transphobic sentiment. We are really clear on the boundaries and the rules about who can be included into different workshops, events, and spaces. And we also make sure that our staff team, the consultants that we use, and our volunteer force are inclusive of, and as we actively recruit trans people and non-binary people to be part of everything that we do. We also know that some of those conversations around trans issues and issues around non-binary identity are new for some people, are sometimes challenging, and we want to make space, safe space, to have those conversations so that people who maybe don't understand issues around pronouns or don't understand issues around genitalia that they may not have experienced or may not have had conversations around what it's like to be going through a transition, that all of those conversations can be had in a supportive, culturally appropriate and engaging way. And I think we all still have work to do. And I'm not saying I'm not saying we hold the Love Tank up as the bastion of 100% excellent practice. We absolutely accept that we have more work to do. And I would challenge any organization to say they currently have it right. we are really clear in the statements that we make and in our practice that transphobia will not be acceptable, and it will be challenged by us. And we've recently signed letters and statements that have demonstrated that commitment.
Thank you. Thank you so much, both of you, Marc and Will. A big round of applause for Marc and Will for inspiring us to take sexual health promotion for queer men to the next level through the lens of queer sex after HIV, which goes well with our agenda and theme. Thanks again, everyone. Please join us in the networking session at 12 noon right now, where we can further debrief and connect.